Internet of Things is a very disruptive technology. It will change the way we think, we live and we work. Internet of Things comprises machine-to-machine communication and machine-to-human communication. Machine-to-machine communication means the transfer of data from one machine to another machine without any human intervention. It is very important that there should not be any human intervention. And there is a projection that there may be around 50 billion connected devices across the globe by 2020. In India, we may have around 2.6 billion connected devices. These devices will be in various verticals like automotive, healthcare, agriculture, safety and surveillance, water monitoring, smart street lights. There will be large number of verticals and the applications, and the main goal is it will improve the quality of life. And this out of 50 billion connected devices, there will be only 17 to 18% connected devices, which will be the smartphone, the tablet and the PCs. The remaining 83% will be the conventional devices, which we may see like the connected fridges, wearables or the connected car, etc. IoT will really improve the quality of life in the healthcare also. And in the healthcare domain, as on date we are feeling a lot of stresses. There is a lot of shortage of beds in the hospitals. We are not having sufficient number of doctors and the nurses, and in the rural area there is a lot of shortage of doctors. Even we can say we don't have the good hospitals and doctors in the rural areas, and even in the smaller towns the big hospitals and good doctors are available only in the big cities and the metros. And by using this technology, we can transfer the vital parameters of the human being from the rural areas to the urban areas. This vital parameters can be transferred from the devices which will be having the sensor and the communication technology to the laptop, and from there using the WAN area communication technology like the cellular or the optical fiber cable, it will come to the cloud. And the doctor sitting in the urban area, they may see the vital parameters and may advise the patients accordingly. Similarly, we are having a lot of shortage of beds in the hospitals. After surgery of the patient can be shifted to the home. He can rest at home, and EICU may be created at home. Similarly, we can connect a number of smaller hospitals, city area in the big hospitals. They may advise the smaller hospitals to take proper necessary action. The wearable devices will play a critical role in this domain, in this vertical, and from these wearable devices we can see the sugar level, BP, ECG, and these can be transferred to the physician or the cloud by using the smartphone. Actually, in the case of healthcare, availability of the devices is less. Their prices are quite high, and and even the proper standards are not available. These devices should be of plug and play type, so that everybody should be able to use these devices. No expertise should be required. Even in the rural areas, the Anganwadi workers should be able to operate these devices along with the tablet or the laptop, and take the data of the patients from these wearable devices to the laptop, and should be transmitted to the cloud. For the economy of scale, it is very much required that we should have proper standards and interoperability of the devices. We should have proper communication network so that the data is transmitted in time. Otherwise, what will happen if we are carrying the patients in the ambulance and vital parameters are being transmitted, and suppose signal goes down, then it will be difficult. It is an emergency situation. For this, the embedded SIM has also come into existence, which can have the subscription of more than one operator. There is a lot of opportunities. Even in India, the Philips Healthcare is making the devices in the health domain. There is a number of startups who are making the devices like ECG device has been created by one Bangalore-based startup, and there is a lot of opportunities. And these devices should be of on open standards, so that these devices should be of plug and play type. No proprietary standards should be used.